Have you heard of the word stroke? But you don't really know what it means. Now, every second counts when it comes to this life-threatening condition. On today's episode of Health Unplugged, we'll be talking about everything that happens during a stroke. How some lifetime modification can just help you prevent it. This is not just medical talk. This is information that we are sharing that can save your life and that of someone else's. My name is Amazing Rita. I'm in the studio with the amazing Dr. Dimba Favor. I've added amazing for you now. So you just shake your body small. Welcome. So we'll be talking about stroke and everything that concerns. We want to let people understand everything that happens during a stroke. So tell us, Dr. Favor, what is a stroke and why is it called a brain attack?
Stroke is a rapid, mark the word rapid, a rapid loss in brain function, and is usually due to a disturbance with the blood supply. This disturbance could be either the vessel, maybe the vessel got weak or the pressure in it got so high and then it ruptured. And then when it ruptures, it's not the blood that is supposed to flow through it into the brain is not able to get to that area. Because, okay, imagine now this is a blood vessel. Blood is supposed to go through it into a particular region of the brain. But now, maybe this vessel gets weak or the pressure in it gets too high. It ruptures, it tears, it breaks. And then the blood, let me assume the break is at this point. The blood starts seeping out from here. So you can see the blood that is meant to travel this vessel is now seeping out. So where the area it was supposed to supply will now be void of blood.
Okay.
So that could be one way a stroke could happen. Or something could block that vessel. Imagine now, like fat or blood clots or just anything is blocking the space through which that blood should travel. So it has blocked the area and then the blood can no longer get to its destination. So this will cause the brain to have a rapid loss in its function. Then it is called a brain attack because, like I said, an attack is usually sudden.
Sudden.
Exactly. So it's rapid, it's sudden. And then in an attack, like damage is always caused.
Yes.
There's always harm. So in the brain, that portion that is supposed to get blood would no longer get blood.
Wow.
So that is an attack that is ongoing at that moment. So that's why they refer to it as a brain attack. Yes.
Rapid. Happens all of a sudden.
Exactly.
Oh my God. What are the different types of stroke?
Okay, majorly we have two types of stroke.
Okay.
We have the ischemic stroke and the hemorrhagic stroke.
Okay.
But then under the ischemic stroke, we now have what is called TIA.
Okay.
Transient ischemic attack. So what happens in these different forms of stroke? In hemorrhagic stroke is the one I explained where I said the blood vessel, maybe it gets weakened or the pressure through in it, the pressure going through it is too high and then it ruptures. So the blood will start seeping out. So that's like hemorrhage. Hemorrhage just means bleeding.
Bleeding.
Exactly. So that's hemorrhagic stroke. Then the second type of stroke we have is ischemic.
Okay.
Ischemic stroke is the one I equally explained, where something blocks the blood vessel. Sometimes this block may not be total blockage. Do you understand? So now imagine this is the space, the blood vessel, and then let me say maybe fat or plaques from fatty tissues or a thrombus occupies, let me assume, half of the lumen of this vessel. So you see, the full lumen is no longer open for the blood to flow through.
Yes.
So the blood will be struggling to flow through the remaining half. Or a case where it is totally blocked by whatever it is that is blocking it. So that is an ischemic stroke. Then I told you under ischemic stroke, we have TIA. Is an abbreviation for transient ischemic attack. So a transient ischemic attack is a type of ischemic stroke in the sense that it's caused by something occluding the vessel.
Okay.
However, the difference between it and an ischemic stroke is that it usually resolves within 24 hours.
Okay, it resolves.
Yes. before 24 hours. That's why you call it a transient.
Okay.
It's not long
Yes.
lasting.
Okay.
Yes, usually before 24 hours it
Does
resolves.
it resolve on its own or
It resolves on its own most
okay,
times
most times.
in less than 24
Okay.
hours, yes. But anytime it exceeds 24 hours, you would know that this is now an
Ischemic
ischemic
stroke.
stroke,
Okay.
yes.
So tell us what happens to the brain during a
Okay.
stroke.
Okay, during a stroke, like I said, that's the quantity of blood. Remember, blood is almost like life. Blood is life,
Yes.
yes. So that blood coming to the brain is coming with oxygen, nutrients, and these are the things the brain needs to function optimally. So in a case where whichever of the causes I just explained, this brain tissue is not getting adequate supply, it can die off. If it's an ischemic stroke, that area will start undergoing necrosis. It will start dying off. Same with a hemorrhagic, because in any route is taken,
Yes.
the end of it is that blood is not
Not
getting to the brain
clearing.
tissue.
Yeah. Okay, tell us some of the warning signs that we can
Okay.
see, or warning symptoms that someone can see when
Okay, that should tell you this
yes.
person is about coming
Yes,
down with a
yes.
stroke. Okay, sometimes you could see a facial deviation.
Oh.
What do I mean by facial deviation? This is my face now, and then it's centrally placed. But sometimes it could deviate to one part, either the
Okay.
left
Or
or
the
right.
right.
Sometimes you could even see the tongue deviate as well. Sometimes this person will be having difficulty with speech and even understanding what others are saying. Sometimes the person could come down with weakness of a part of the body.
Body.
Yes. Sometimes it could go as far as loss of consciousness. Person will lose consciousness. Sometimes there could be throbbing headache, very severe headache. Sometimes it could affect vision. There will be blurry vision. So these are some symptoms the person can come down with.
Okay. Okay. That's when you see some of these people that stroke has affected, you see probably their
Yes.
lips
Okay, it's tilted
bending,
to one
yes,
side.
tilted to one side. Wow. And it also affects their brain too, like you said, they will not be
Exactly.
able to comprehend things so much. Okay, so or should I say, what is the leading cause of stroke, or the major thing that causes stroke?
Okay. Like in the case of hemorrhagic stroke, majorly hypertension.
Oh,
And then from the types of stroke I listed, ischemic is most common.
okay.
Yes, let me say out of 100%, ischemic takes about 80 to 85%. Yes. So for hemorrhagic stroke, hypertension is like the leading cause of stroke. Then for ischemic stroke, different things could cause it.
Okay.
First of all, remember I told you anything that could form a
Plague
plague
or block.
or anything that could block the
Block.
vessel. So this could be fat embolus, it could be plagues from increased lipids,
Okay.
it could equally be already formed blood clots. Imagine if something bleed, if I have a bleed now, because of platelets in
Yes,
the
it will
blood
clot.
coagulates, exactly. So that clot could form and then occlude the vessel.
Okay.
So sometimes there's something they call atrial fibrillation. Is when how do I explain it now? When the valves, the heart is not contracting properly to push out blood. So when the blood is stagnant at a point for too long, it could form clots. And then imagine the heart now pumps with force, it will push out that clot, and then the clot will go into circulation. So these are some causes, including obese people at
Yeah.
risk of atherosclerosis. Atherosclerosis is when these plagues rub off on the blood vessels. So obesity can cause atherosclerosis. People who are having hyperlipidemia, increased lipids, they're at risk of it as well.
Okay. Okay. All right. So both lifestyle and both what we do and
Yes.
affects. Tell us, what is stroke hereditary? Like family
Yes.
history, does it matter when it comes to stroke?
Yes, it does. There's positive family history of stroke has a role to play. When you're considering risk factors for stroke,
Okay.
positive family history,
Okay.
yes, has a role to play.
Can young people suffer from stroke, or just an old people something?
No, 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 it's not just for old people. Young people as well can suffer from stroke, especially ischemic stroke. Like I told you, anything that could form plaques on the walls of the blood vessels. Yes. So now, even based on our lifestyle modification these days, yes, the things we consume, you can see young people that are very obese. So it's not strictly for old people.
Old people.
Yes, irrespective of age. And then race as well.
Okay.
Race has a role to play in risk factors for stroke. Yes, it affects more of blacks.
Okay. So if someone should be down with stroke,
Okay.
is there any other thing that stroke can cause?
Yes, there are things it can cause. It can cause speech affectation.
Oh.
It can affect movements. It can affect sight. It just depends on the area of the brain that is affected.
Oh, okay.
Because the area of the brain responsible for movement is still located in the brain, the cerebellum. The area responsible for speech is located in the brain. The area responsible for understanding, like when you communicate to me now, I can understand, is still located in the brain. So it depends on the area that is affected by the stroke.
Oh,
It depends on the area that doesn't get blood. Yes. So if the stroke affects the area that is in charge of speech, the person's speech would be affected.
Well, that means okay. So if it affects any area of the brain, the person's speech will be affected. So what do doctors see? What do they see to diagnose that this is stroke?
Okay, like I said, first of all, you have to take a good history. In your history, what are you looking out for? You're asking questions like the symptoms I told you this person can present with. Is there any time? Are you a known hypertensive? First of all, like I said, uncontrolled blood pressure is a huge risk factor for especially hemorrhagic stroke. So you want to ask this person, are you a known hypertensive? How well do you control your blood pressure? Have you noticed anything like a facial deviation, a tongue deviation? How is your speech? Sometimes because most times when a patient with stroke comes to the facility, the patient usually does not come alone.
Yeah.
Yes, because at that point, the patient can't even communicate properly. The patient some of them, they present unconscious, so they will come with the relatives, and the relatives will be like, I just noticed that yesterday he was complaining of severe weakness, or he walked to the bedroom and then had a fall, or he started complaining of one-sided weakness. Just
I couldn't understand.
Exactly, random complaints like that. Because most times the patients are not able to communicate by themselves. Then afterwards, after getting this good history, you want to examine, you want to check for power, you want to check for tone, you want to check if this person is still oriented in time, person, and place. You do some examinations, and then you can send them for investigations, majorly imaging. And then in the imaging, you want to check if there are ischemic areas in the brain. You have to send for CTs, MRI angiography to check if there's still adequate blood flow through the vessels. You also want to send for some baseline investigations in order to, let me assume now this patient comes in unconscious. You have to send for other investigations to make sure that, because hypoglycemia, low sugar in the blood, can equally cause someone to be unconscious. You want to rule out every other cause of unconsciousness. So these are ways to know that this person is actually having a stroke.
So do people recover from stroke?
It depends. It depends on the extent of injury to the brain. Yes, but like I said, a single stroke is always a risk factor for subsequent strokes.
Okay.
Yes, so it depends on the extent of injury. It depends on the time which this stroke was arrested. Like, at what time was attention given to this person after he complained? So these factors help to know or to determine if this is reversible.
Okay, so there are some people that don't recover fully.
Yeah, some people would not recover fully.
Okay, now for people that recover, now you said that if it happens to the person once, it can put the person at risk for other
subsequent
So for people that recover fully, will their memory and everything come back to normal?
Yes, it's very possible. But like I said, it depends on the extent of the stroke.
Okay.
And then it also depends on the duration. Like, did you make good use of that golden hour, the time from when this thing happened till when prompt attention or
Yes.
medical care was given?
I've seen people that when
Yes.
they suffer from stroke, you hear like they ask them, do you drink? Do you smoke? You know, that kind of thing. So are there
Yes.
lifestyle habits that can actually put one at risk of suffering a
Sure.
stroke?
Yes. Lifestyle habits like sedentary lifestyle, like I always say, yes. Someone just consuming and then not being active. Yes, because that person is at risk of getting obese. And people who are obese, they almost, most of them almost always have hyperlipidemia.
Okay.
And lipids can deposit
Block.
plaques on the blood vessels. Also, smoking, like you said,
Yes.
smoking can affect the blood vessels, the elasticity. Smoking can also cause chronic inflammation, alcoholism, then obesity. Like people that eat, anyway, it relates to the sedentary
Yes.
lifestyle.
Yes.
Then hypertension, what we consume, like the sodium we discussed in our previous
Yeah.
video. Yes, excess sodium intake has a role to play in increased blood pressure. And hypertension is one of the risk factors for stroke.
Okay. All right. Then for people who are suffering from diabetes,
Okay.
that diabetes, will it put them at risk of stroke?
Yes. Like I said, people who are suffering from diabetes is almost always linked to hyperlipidemia.
Oh, okay, okay, okay.
Yes. And then hyperlipidemia, lipids are deposited, forming atherosclerosis. Secondly, people who are obese is almost, people who are obese, they almost always come down with hypertension as well. So hypertension is a risk factor for stroke, especially hemorrhagic.
There are some people also who, after suffering, will probably they suffered stroke, maybe recovered or
Yes.
they not recover. They
Okay.
fall into mental health issues,
Yes.
depression, anxiety. How do they link?
Okay, like I said, it depends on the area of the brain
That
that
was
does not get blood.
okay.
Yes, the area of the brain that is affected by the stroke. If it's the area that is responsible for cognition, memory, the person will be having memory loss. If it's the area that is responsible for speech, the person will have speech difficulties, maybe slurred speech. If it's the area responsible for movement that was affected, the
Yes.
person will start having issues with movement.
So why is it important that we recognize the signs, the warning signs of stroke?
Okay, it's very important because from the time those symptoms are peaked till when you do something about it is a very important time. There's something they call golden hour.
Okay.
However, yes, golden hour is the first 60 minutes.
60 minutes.
Yes, first
Okay.
60 minutes, especially in hemorrhagic stroke. But for ischemic stroke, the first 3 to 4.5 hours after the first symptom is what we refer to as the golden period.
Okay.
Yes.
Uh, what are the treatment plans
Okay.
available to people who suffer from stroke or who suffered stroke?
Okay. First of all, it depends on the kind of stroke.
Okay.
Because if it's ischemic stroke, the treatment plan is different from a
hemorrhage.
hemorrhagic stroke.
Alright.
If it's ischemic stroke, depending on when it occurred, like I said, the first 3 to 4.5 hours after the stroke is very important because at that point you want to give antithrombolytics. Antithrombolytics are things that would break down the thrombus, the clotted blood that has formed. Yes. So you want to give antithrombolytics. You want to give antiplatelets, things that would help the platelets not to clog or clot easily. You also want to, if the person has other comorbidities, you want to treat them. Like if the person is a diabetic patient, you want to handle those ones. Then if it's a hemorrhagic stroke, you're very, 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 very interested in handling the blood pressure. You want to make sure that there's usually a target range. You want to make sure this BP is usually not above 140 over
Okay.
90
Okay.
and not below 120 over 80.
80.
So you're very keen with the blood pressure. Then you also want to give things that are neuroprotective,
Okay.
some antioxidants. You also want to, and then it's always important to know when physiotherapy will come in.
Okay.
Like I said, for someone who the stroke affected the area responsible for movement, yes, this person will need a physiotherapy. Then if it's someone who speech got affected along the line, you have to invite a speech therapist.
Yes. Okay. Then for people who maybe friends, relatives,
Yes.
family that are around people suffering from stroke,
Okay.
you get, and there's a stroke attack immediately. I've seen
Yes.
people pour people water. I've seen some use wood
Are you
trying
for
to
real?
hit it
The
out of
patient.
it. So what can the people around do just to help at that particular point? They may not be
Yes.
able to do anything medically, but what
Okay.
can they do?
Okay.
But that heating and water, does it help?
No, it don't. It worsens things.
Oh, worsens.
Exactly, because I feel maybe they're pouring water. Previously they'll be like when someone faints, pour the
But
person water, and the
water.
person will. And so I told you some stroke patients could present as unconscious patients. So they're assuming this person just fainted, and then they're trying to pour water to resuscitate the person. But then it causes more harm than
Than good.
good. Even flogging the person with a wood or doing all those things, they will really not help. So I know they can't really do anything medically, but at that point, they should just try to ensure the person is in a safe space.
Okay.
Because some people having a stroke, they could start seizing, having a seizure. So just ensure the person is in a safe space, and then as quickly as possible, rush the person to the hospital.
Okay.
But before even allowing that to happen,
Yes.
I think little things like encouraging this person to be adherent to his antihypertensive, maybe anti-diabetics, regular exercising would help prevent this from happening.
Oh, thank you so much, Dr. Favor.
Yeah.
It's one thing I enjoyed, or one thing I learned about today is the fact that you said, depending on what part of the brain it affects, that's the
Yes.
physical attributes you see the person exhibit.
Yeah.
Yes, but like you said, modifications, and then knowing if you're hypertensive or not can actually help prevent you from having
Coming
a
down
stroke
with a
attack,
stroke,
coming down with a
because
stroke.
you get to see some people when they bring their relative unconscious, and then you've made your diagnosis from your history, from the examinations, you just know that this person is down with a stroke. But then the relatives, they are not even aware that this person is a hypertensive patient.
Yes.
Because when you ask, they'll be like, he's not a known hypertensive.
Yes.
And then where is this coming from? So one advice is that we should learn to keep our blood pressures in check.
Yes.
Even if you've never been a known hypertensive, it's just important to check it. Because I know we've once had a session on hypertension.
Yes.
The vessels, they have this adaptability, like they can keep they can keep expanding, they are adapting, but it gets to a point where the vessels get weakened or the pressure is too much, and then it ruptures, and then before you know it, this person is suddenly coming down with a stroke.
And then again, I think people should also understand how to share news, because some people will share news to somebody and it will just trigger the hyper.
Exactly.
Thank you so much for sticking around with us on today's episode of Health Unplugged. So, if you have anyone who is hypertensive, this is another call to action to make sure that they monitor their blood pressure and keep it in check. Till we come your way again, my name is Amazing Reader.
I'm Dr. Dimba Favor.
And we'll see you next time. From us, it's bye for now.